Well, after more than a year without a locally acquired COVID case, Canberrans are waking up this morning to a 7-day snap lockdown. ACT Chief Minister Andrew Barr joins us now. Good morning to you. What's the latest this morning?
Look, we've had a record number of tests overnight, so we're awaiting results from those tests. We'll get those later today, be able to update the situation around midday. But yesterday evening we were able to confirm that 3 close contacts of the original case had tested positive. We've been able to add some additional exposure sites to the list so that the community and people who've been in those locations can come forward for testing. We are seeking to prioritise those close contacts who've been contacted by ACT Health and people who have symptoms for testing. We have had an extraordinary response from the local community to want to come forward to get tested. But what we're asking people right now is that we need to get really focus on those who have symptoms and who have been identified as close contacts. We'll be running testing centres, extended hours with additional staff to get through the backlog. But right now, we've got a priority to ensure that we can get ahead of this virus and we can get all of the close contacts and people who are likely to test positive into isolation. OK,
so let's look at this man in his 20s. Do we know yet whether he'd been to Sydney or any other hotspots?
No, we're still trying to get to the bottom of how he became infected. There's genomic testing underway and we're expecting the results of that later today. We've got an immediate priority, of course, to focus on the close contacts and the potential community transmission within the ACT. There will clearly be a backstory here that we will find out. But at this moment, the number one priority for us, aside from getting everyone into lockdown and reducing the transmission potential from people not moving about, is to focus on those close contacts and people who have been to the exposure sites. That's potentially thousands and thousands of people. Some of the places that the original case had been to included nightclubs and popular retail outlets, bars, cafes, an active social life, it would be fair to say, as you'd expect from someone in their 20s. And so this is the immediate challenge for us.
Why do we not know whether, given he tested positive and you knew about it yesterday, why don't we know yet whether he was in Sydney or any of the other hotspots?
Look, there's obviously been an extensive set of interviews with the individual to work through all of the places that they'd been. Fortunately, was a really avid user of our check-in CBR, our QR code system, so that helped identify all of the places that he'd been to. But we've had to interview quite a number of circles of people around him. So look, we're inside really the first 24 hours here. We'll get some further information on that, and I'll be doing an update at lunchtime once more information's available. But at this point, as I say, we've got a few things we definitely need to focus on. There will be a backstory, clearly, and once we have that information and have it confirmed, then we'll be in a position to talk more about that. But right now, what I'm focused on is ensuring that we get the best information out of the individual and their close contacts about where they've been so that we can protect the rest of the community.
Any of those that have tested positive in hospital?
Not at this stage, no.
OK, and if you had to ask for any additional help on the tracking and tracing, it's a big job you've got there. You haven't faced this kind of challenge before.
Not at this stage, but that may be necessary. I hope not. The purpose of the lockdown is to stop people moving. The virus only transmits when people come into contact with each other. So that's why we went hard and immediate in order to reduce the risk of ending up where Sydney is now. If we had 300 cases a day and tens of thousands of close and casual contacts, then yes, that would overwhelm our contact tracing system in the way that the New South Wales system has been overwhelmed. So, we are, I think New South Wales is 20 times bigger than the ACT. So, obviously our resources are commensurately smaller than is available for New South Wales. That's why we need to get on top of this now. That's why we've put in place the measures that we've put in place. And it's really, really important at the moment that we focus on the close contacts and casual contacts at the exposure sites. And that's what we're doing.
You had a few people bolt for the border yesterday. What did you make of that?
Look, frankly, I'm disappointed and somewhat embarrassed that Canberrans thought it was the appropriate thing to go down to the South Coast, where they don't currently have COVID cases and they don't have a health system that can cope if there is an outbreak. It's the wrong thing to do. It's antisocial, and I suspect that those communities on the New South Wales South Coast that see ACT number plates will be anxious and frustrated and upset. Now, of course, there will be some Canberrans who are already down there. And so I appreciate this is going to be a tricky and difficult situation to manage. But my plea to Canberrans is we are in lockdown for a reason. Don't leave the ACT. Stay at home. Stay in your local area. The way the virus spreads is when people move around. And so going to the South Coast now is the most selfish and stupid thing you could do.
Can I ask you, what happens after the 7 days of lockdown as far as people wanting to come into the ACT from New South Wales? What are you going to do about that?
Look, we're just going to have to constantly monitor this situation. We have in place a range of essential worker permits and arrangements for people who do need to come into the ACT for a range of essential reasons. That can include healthcare and access to services that are only available in the ACT. We are a very integrated community with our Canberra region that sits just on the New South Wales side of the border. So this is going to be a very challenging period. But right now, as I said, our focus has to be on containing this outbreak, and we need to work well with New South Wales, particularly the surrounding local government areas, to ensure that it doesn't leak out of Canberra into places like Queanbeyan. But it's, it would seem that it's got into the ACT from other parts of New South Wales. We'll obviously confirm that in due course. But a problem in the ACT is a problem for New South Wales in the way that problems in New South Wales have clearly been challenging for the Territory. And
just on that note, National Cabinet today, suggestions that it could be a bit fiery because there are a lot of leaders who aren't happy with how Gladys Berejiklian has handled this. How do you feel?
Well, look, I've been concerned at, I guess, a different reporting of New South Wales' position in the media in New South Wales as opposed to what I've been hearing inside the National Cabinet room. So either there's some backgrounding going on here or there is a mismatch, quite a different position. My understanding of New South Wales' position is that they are not suggesting that at 50% first dose level or 50% fully vaccinated that they are just going to unwind and do away with a lockdown whilst they've still got hundreds and hundreds of cases every day. That is a crazy position, but of course it would be open to them to make some minor adjustments to their lockdown settings. And so I think there is a conflation here of the National Cabinet decision around the Doherty Institute modelling and what you might be able to do in terms of a gentle step forward at 70% national vaccination and then a further step at 80%, as opposed to New South Wales or the Greater Sydney region lockdown provisions. And there's quite a lot of confusion there, but my understanding, and this was reinforced because these questions were asked in National Cabinet and will continue to be asked, is that New South Wales will not do something wildly irresponsible and put the rest of the country at risk. I would be stunned if they did, but that's not my understanding of their position. But it probably would be helpful if that was clarified.